What does it mean to have psychosomatic symptoms? Butterflies in the belly, racing heartbeat, sweaty hands, shortness of breath. Almost all people have, sometimes, experienced these kinds of psychosomatic signs, typically in response to stress and anxiety or anxiety. Yet what takes place when these signs and symptoms end up being a daily event and begin to interfere with our lives? Suppose we become fixated on them, as well as, perhaps most notably, just how do we differentiate psychosomatic signs and symptoms from serious medical concerns? Allows have a look at the sensation of psychosomatic symptoms as well as diseases, and also what you require to recognize if you are experiencing them. What are psychosomatic health problems? Psychosomatic health problems happen when people establish physical signs that have no clear medical reason and also appear to be affected by the individual's emotion. Occasionally, psychosomatic signs and also illnesses have unfavorable undertones. You may be informed that what you are experiencing is done in your head. However, while there is a mind and body link taking place when it comes to psychosomatic signs and symptoms, the physical symptoms themselves are very actual and can be quite significant sometimes. What is somatic sign disorder? At times, individuals that experience constant psychosomatic symptoms might end up being obsessed on them and also create somatic signs and symptom problem, which the American Psychiatric Association, ARPA, defines as when one has a significant focus on physical signs, such as discomfort, weak point or lack of breath, that leads to significant distress and/or problems functioning. Experiencing psychosomatic signs and symptoms periodically, however, doesn't imply you have the problem. In order to be detected with somatic sign condition, you need to experience extreme thoughts, sensations as well as habits relating to the physical symptoms, the ARPA clarifies. What triggers psychosomatic signs and symptoms as well as diseases? Psychosomatic ailment, psychosomatic problems, as well as psychosomatic signs are typically brought on by medium to high levels of stress and anxiety, or anxiety. Basically, it's a body and mind phenomenon, however it's also a little bit extra challenging than that. What is the function of tension in somatization? When you are experiencing emotional distress, your body launches hormones such as adrenaline as well as cortisol. These aren't necessarily negative, they are battle or flight hormones secreted by our bodies when we really feel stressed out as well as anxious, and also they assist us act swiftly on our feet, and also secure ourselves from danger. A type of tension called eustress refers to the favorable tension that encourages us to wake up in the morning and also encounter our to-do list with vitality. When excessive quantities of stress hormones are launched, they can cause awkward symptoms such as digestive issues, heart issues, consisting of boosted blood stress, lack of breath, and chest pain, as well as a host of other psychosomatic symptoms. Stress and anxiety hormones can also create variations in serotonin degrees in addition to a weakening of your immune system, both of which can exacerbate or aggravate physical ailments. Danger aspects for psychosomatic symptoms as well as ailments. Everyone experiences psychosomatic signs occasionally, however some individuals are extra susceptible to these signs than others. There are particular danger aspects that may make you susceptible to more constant psychosomatic symptoms or make you more likely to experience a psychosomatic disorder, including having a background of stress and anxiety or clinical depression, having actually experienced a current stressful occasion, having a background of childhood years trauma. Some people appear to have a hereditary propensity to be much more conscious pain and to somatic experiences. While none of these aspects are straight linked with psychosomatic signs, there is a strong correlation, and also a certified therapist can collaborate with you to much better comprehend what may be contributing to your experience. What are the symptoms and signs of psychosomatic health problems? There are several symptoms and signs that are psychosomatic in nature. It is essential to understand two fundamental principles about psychosomatic symptoms and also diseases. Psychosomatic signs and symptoms can differ extensively from one person to another, as well as your signs might transform considerably from day to day as well as year to year. You can just make sure that a signs and symptom is psychosomatic in nature after your doctor has dismissed various other severe causes. Some psychosomatic symptoms overlap with major health and wellness conditions, which is why it is essential for you to dismiss those first. Several of the most usual psychosomatic symptoms consist of nausea or vomiting, irregular bowel movements, gas, looseness of the bowels, puffed up tummy, fast heartbeat, fast pulse, shortness of breath, chest pain, increase in high blood pressure, mind haze, migraine, perspiring hands, chronic pain, neck and also shoulder stress. Once more, if you experience any one of these symptoms, specifically upper body discomfort, quick heartbeat, lack of breath, enhanced blood pressure, or a sudden migraine, you ought to seek healthcare, as these signs and symptoms might be a sign of a severe clinical issue. You should not self-diagnose significant signs. You will only get a medical diagnosis of psychosomatic symptoms when all various other conditions or causes are dismissed by your treatment service provider. Are psychosomatic signs and symptoms hazardous? In and also of themselves, psychosomatic symptoms are not damaging. If you experience persistent stress and your signs and symptoms come to be ongoing, you might experience a decline in your high quality of life. You might find that various other health and wellness issues are exacerbated, and your signs may lead to raised feelings of anxiousness or clinical depression. That's why it is very important to take psychosomatic symptoms seriously as well as look for therapy for them, just as you would certainly for any type of clinical problem. In the case of real psychosomatic symptoms, you would likely look for the care of a medical professional, certified therapist, counselor, or a person who can assist you with stress monitoring and also psychological wellness issues. Exactly how are psychosomatic ailments and symptoms dealt with? If you have actually seen your doctor and your signs and symptoms or ailments have been diagnosed as psychosomatic in nature, there are a couple of things you can do. If your doctor feels that you are dealing with substantial mental health and wellness challenges or might just use some aid handling your anxiety, clinical depression, or anxiousness, they will likely refer you to a mental health and wellness professional. A therapist or counselor would certainly be able to assist you identify what is causing your stress as well as suggest methods for handling your sensations so that they become much less extreme and also much less most likely to exacerbate your symptoms. Treatment and therapy solutions can be in person, or using telehealth services like Talkspace. In addition to speak therapy, your therapist might advise psychological medication, which can aid you handle your anxiousness or clinical depression as well as also lower your psychosomatic signs. Still, tackling the tension as well as emotions activating your psychosomatic signs may not be enough. In some cases, it is necessary to treat your psychosomatic signs and symptoms medically. For example, if you are experiencing persistent discomfort as a result of tension, taking medicines must not be dismissed. The same holds true for digestive concerns and also nausea symptoms. Drugs for food digestion pain and also nausea or vomiting might be appropriate. Even if you don't have an infection or condition does not indicate you need to experience. Not only that, yet experiencing high levels of pain usually just makes tension even worse, producing a continuous cycle of stress and anxiety and also psychosomatic signs and symptoms. How to cope with the stress that causes psychosomatic illness. Besides talking with a therapist or a psychological health and wellness therapist who can help you determine the idea patterns, relationships, life conditions, or other dynamics that might be triggering you anxiety, there are some easy lifestyle adjustments you can implement yourself to reduce stress and anxiety and likewise stop signs. The essence here is to cool down your anxious symptom. Express your sensations to make sure that they do not remain suppressed, and learn how to recognize the initial indicators of tension so it doesn't spiral out of control. Below are some activities that might aid. Workout. Even a quick everyday stroll can aid you take care of stress as well as provide you an opportunity to think of how you are feeling. Journaling. A great means to explore your feelings safely as well as freely. Reflection as well as breathing strategies. These tools can assist you learn to calm your nervous system when you begin to experience anxiety. Daily check-ins. Speaking to trusted enjoyed ones can provide you an outlet to reveal your feeling as well as generate healthy methods of handling relationships or tight spots. Obtain enough sleep. When you're sleep denied, you're more probable to respond to demanding circumstances extremely, as well as are much less able to deal with misfortune. Sleep is essential to mental wellness. Decrease sugar and caffeine. Cutting back on these compounds can help reduce stress and anxiety in addition to psychosomatic signs and symptoms. Self-care. Adding self-care right into your regimen can help. Also, a few minutes a day where you can concentrate on your very own demands and also satisfaction, whether that be a cozy bath, a leisure activity, or enjoying your favored television program, can work wonders for your stress degrees. All-time low line. Experiencing psychosomatic symptoms can make you really feel vulnerable, specifically if they become persistent or disrupt your life. If you're in a location where your symptoms are making it hard to work, for instance, if you experience chronic pain or chronic gastrointestinal issues, you may feel hopeless to really feel better. You may additionally really feel dismayed if healthcare experts appear prideful of your signs and symptoms because they are not a measure of a physically diagnosable clinical condition. Bear in mind that despite the fact that your symptoms are psychosomatic in nature, they ought to be taken seriously, and you ought to feel equipped to get the care that you should have. Your signs are actual, as well as treatment is out there to assist you manage your stress and anxiety, decrease your symptoms, as well as live a healthy and balanced and well-balanced life. If you're searching for aid with psychosomatic signs, consider online therapy a practical, cost-effective way to begin.